Welcome everybody to another edition of Let's Clarify with myself, Mellissa Thomas, and the one and only Angel Perry, who is the lovely co-host and the Executive Vice President of the Communications Workers of America, Local 3108. How's it going, Angel?
It is going great. How are you, Mellissa?
Doing good. Always a pleasure to have you on. So let's get into this. Technically, this story has been going for the last 2 weeks, but let's do our part to zoom out and kind of demystify the pushback that we're now seeing with New York Governor Andrew Cuomo and basically the state of New York in terms of their kind of hesitation in reporting the total numbers of COVID-19 deaths they were seeing in their nursing homes. Like, what have you seen in your digging that you could kind of help our audience kind of look past the headline and learn more about?
So a few things I wanted to highlight, maybe just a couple things. So back in January and February of 2020, when the virus had just hit our shores, people in general, just, medical professionals, those that take care of residents of long-term care facilities, have specific protocols. If a resident gets, too ill to take care of at the facility, it is usually policy, procedure, depending on state, local municipalities, local policy, and the actual establishment. Okay, we got to take this person, take them to the hospital. They're having respiratory, they're having whatever. And then when that person is well enough to recover, because most long-term facilities have basic medical, the medical bed, nurses on staff, all of those things, we'll take them back. Now, across the country, as the infection rate increased between people, you got to remember each of these long-term facilities or home care units, nobody really understood what was going on with this virus, like how it was spread, or what the damage done. There was no even testing yet.
Right.
We're pre-testing. So my understanding in New York, the facilities are very similar to anywhere else in the country. Take the person, they're not feeling well and they're beyond our ability to care. We have to then move them to a hospital, an actual hospital, intensive care unit.
Right.
So the spread during those facilities would be the patient would be at the hospital with COVID. Either they had it and that's why they're at the hospital, or they got it at the hospital and then was returned back to their room at the facility. In which case there was no protocol, there was no social distancing yet. The residents grouped together. I mean, if anybody has a loved one, you had your activities together and the person's coughing. There was no masking yet, none of those things. So you had whole groups of people, unfortunately, all contaminate each other and they all passed away within weeks. And we had that here in Florida. We had it all over the country. So that's what people need to just slow down and remember, that those first few months before anybody even identified COVID-19 as a pandemic, there was nothing in place. So the virus just spread like wildfire.
Right.
Yeah. Unfortunately, that took a lot of loved ones with it.
Right.
Yeah.
And even, even with the masking, like COVID-19 is still pretty ruthless. You know what I mean? Like it's still moving pretty quickly. And now, of course, we're dealing with variants and things like that. But imagine back then when it was first starting.
Yeah. But the death rate is way down. And that's because the medical industry was very diligent in discovering therapy. So even before the vaccine, they used the plasma of people that were previously infected that had the antibodies already in their blood system. So the first 90 days after someone's recovered from the virus naturally. They can donate blood, which you can still do, donate blood, and that plasma is used as a therapy to help the next person. And what it does is it teaches that person's immune system how to fight the virus. Otherwise, without those therapies, and I think one of the newer methods also is that when someone is at the worst part of the COVID, they're actually put on their stomach, with their back end raised a bit, because that allows the expansion of your lungs for you to be able to breathe as your body fights the virus. So there's been a number of discoveries of how to handle COVID-19 outside of the virus or the vaccine being administered to a person, which it takes 2 shots. The Moderna and the Pfizer vaccine requires 2 shots about 10 days apart. So those long-term care facilities were a hotbed because everybody was close together. Staff wasn't instructed on anything as of yet. And then we have New York that decided to do something different than everybody else in the whole entire country. Of course, there's questions. Governor.
Absolutely. Absolutely. And actually, that's the perfect point on which we're going to take the first commercial break, you guys. But stay tuned, because we're going to dig into all the questions, all right?
Right.
Because we know you have them as well. So stay tuned. We will be right back after this commercial break, and it will be quick. So, like, literally wet your tongue with a drink of water. We coming back, all right? One of the things I love about Bass Pro is they have 3 great ways to shop.
You can head into one of their awesome stores, visit BassPro.com, or get great gear from that catalog Johnny Morris sends out. Hi, here's your package. Bass Pro Shops, where commitment, passion, and the great outdoors all come together.
Why would you shop anywhere else? And we are back with Let's Clarify. So let's dig into these questions. So right before the break, the key point that you made was that New York was doing something a little bit different than the rest of the states. So kind of talk a little bit about that, because I know a lot of the states were still figuring things out, but they were pretty much reporting what they were seeing in terms of the numbers, in terms of COVID-19 deaths. So kind of talk about that.
So to go back a little bit, some of the guided laws, I think this started back in 2011, were specifically of how the Department of Health handled long-term residents, the rules, and it was, positioned, this is to give you more options.
Mm-hmm.
Laws to give you more options. Okay, well, if I have more options, there shouldn't be any restrictions. That's what the law did. So, reporting, I think, was updated from 48 hours to 24 hours if there was a felony assault, or if anybody got sick, or if anybody died. Now, some of the stuff that was updated was essentially necessary. I mean, it's already a federal crime to assault someone of the elderly age, and care facilities have some reputation, depending on what state you are, that they actually cut corners that shorten the life and quality of life of their residents. So some of the stuff was actually needed. But when COVID hit, and there was potential funding depending on whether you were a hospital care facility, or if you were a home care aid company, where you would send people to the elderly that needed medical assistance or care, it seemed that reporting was delayed. Now, all the states, if someone passed away at a facility, that was reported the next day. If someone passed away at the hospital, that was reported the next day. So some of the questions were, Okay, so initially it was less numbers than what your population suggests. Mind you, you could see the refrigerators full of dead bodies outside of hospitals and care facilities because people were passing away so fast. So how do you see all these refrigerators? Because the morgues were full, the hospitals were full,
Mm-hmm.
but then you're reporting this, that, and the other, and the Trump administration had questions. Like, for your population, the trend is this, this, and this, and it don't match up. It just didn't match.
Right.
We have problems, Governor.
Yeah.
Governor.
And, according to recent reports, and we have a clip here as well, you can see what was reported versus what the updated tally is. And we're talking almost double. So, seeing numbers like that, and especially with what you noted, like, just seeing like, okay, your morgues are full, your hospitals are full, like what's going on. So, Governor Cuomo, during a recent press conference, had this to say at first in terms of the reporting of the numbers in real time. This is a very quick clip, and I'm just going to play it.
All the deaths in the nursing homes and in the hospitals were always fully, publicly, and accurately reported.
Fully and accurately reported.
I do not agree. This is why.
Go ahead.
So when the office of, wherever that person expires, and they put time of death and what they died of, the coroner's, whether it's the coroner's office or the medical care facility, anybody certified to do the reporting, what was happening is somehow the paper was delayed and something else was put there. So, for example, yes, we know that person passed away and they lived in New York, but it could have said, oh, this person had liver disease and that's why they passed away. Or this was a natural occurrence when actually they were already transported to the hospital for COVID.
Mm-hmm.
Right. Or that even if it was a staff member that caught COVID from work, they didn't want that associated with the facility. So one side of his mouth says everything was reported. Yes, it was. Everybody knew when somebody passed away or expired.
Mm-hmm.
What actually happened, like the story that was told, was usually something else. And you can't have your Department of Health update numbers during an investigation if everything was reported accurately. Now, his aide, I think, told a story or the truth. And there was an attorney general that actually said, wait a minute, I think there's something going on here.
Yep.
But I want to say it was Attorney General William Barr. Is that I think that's his name, that was part of Trump's administration that actually started the investigation more than 6 months ago. They said there was something wrong here. And it's just ironic how after Trump leaves office and the next administration says, oh, really? Wait, there really is something wrong here. And now we have questions.
Interesting.
So that's where we're at.
And I mean, I'm going to play this next clip for our audience here, because in terms of what Governor Cuomo chose to take ownership of, it's more so the speed at which the numbers were recorded, but kind of nothing else. Just take a look at this quick clip.
We should have provided more information faster. We were too focused on doing the job and addressing the crisis of the moment. I take total responsibility for that.
Okay, so talking about putting more information out faster.
Okay.
So I guess So the question that some may still have, because I'll be honest, even for me researching this, I was like, okay, wait a minute, because at first one section of this is there was already something afoot at the state level. There was already questions at the state level in terms of state legislators that were asking questions, which is why his aide had come forward to the Democratic lawmakers at the state level. And then there was the federal investigation, looking into what was happening, saying, hey, what's going on with the numbers? And out of concern for getting pushback at the federal level, they decided to do whatever they were doing with the numbers at the state level. And they told the state lawmakers, like, hold off, we're gonna, hold off on our answer to you until we take care of what's going on at the federal level.
Right.
So, I mean, like, you come away with some question marks with that. But one of the things that, you wanted to point out, especially you mentioned it off camera, was the way things were handled even down here in the state of Florida, because Florida suffered some losses too. Like two long-term care facilities had, many of their residents died due to COVID-19, but the nation kind of took note of the way things were handled here. Kind of talk about that a little bit.
So I would have to give credit not only to the governor, but each mayor of the 400 and some cities that we have in this state. Once they got wind of what was happening and how the virus actually spread, so they changed policy immediately. So the first thing was they stopped anybody visiting. They didn't care who you were, how much money you had. Nobody was in or out. And then they double checked, triple checked what they could at the time, which is the temperature checks, no coughing, sneezing, all of those things, with the staff that had the long care facility. And then they pod off the care staff. And what I mean by pod off, meaning that if you were in one section, say your section was the diabetic section, and your another person was just administrative, you were only allowed in the section that was part of your job and nowhere else. There was no cross contamination. Now, additionally, those facilities that were able to update their air filtration systems, or make sure they separated all of the residents. That was the biggest thing. So this was over a course of about 60 days. And I applaud all the mayors around our state and the commissioners that just worked so fast. So we had two facilities that had great losses, and we were like, nope, this can't be happening. And they just buckled down and did whatever they could. And most of the policies are from what the medical industry already knows. When there is a pandemic or when there's anything that is contagious, these rules are in place, and it's not new. It is not new. Masking up. They had make sure they had hazmat suits for the staff, and that's why we ran out of PPE so fast, is because they made sure the staff had it. Anybody going to the facility had it. No cross-contamination. These are all rules in place by the CDC guidelines that were already established for over a decade. This is not new information with the social distancing, masking, washing your hands for 20 minutes. That's something we had in kindergarten, okay? So Florida was just on it. And then, the other states were like, okay, this is working. And they also, combined with CDC guidelines from decades ago, just so people understand the policies in place now isn't new because of COVID. This has already been established for dealing with contagions.
Right.
Not new. So,
absolutely.
Yeah. So I applaud our state for handling things very well in comparison to, New York.
And I know our governor had a couple of shoes to throw at New York during
Absolutely,
back when New York was a hot spot. That was that back and forth was quite interesting.
Oh yeah, because they had the highway thing where people. Oh, it was a secret battle of policies for a little while. Cuomo
For a little while.
And DeSantis was just going at it, but our state did better.
The queen has spoken, y'all. But yeah, on that note, we're gonna, kind of round out our show. We're gonna take a quick final commercial break and just kind of come back and kind of kick around what his political fate is gonna be. Governor Cuomo. Obviously, the pushback, in the name of escalating quickly, things escalated quickly in terms of the pushback he's been seeing. From winning the Emmy and everybody looking at him as a very high and a good leader to follow or look at, and to hear what things are, what these people are saying now is very interesting. So this is another wet your tongue kind of break. This commercial is literally 15 seconds, if that. We'll be right back afterwards. Stay tuned.
At Taco John's, you can expect one thing so good, as in quality ingredients used in tacos and burritos made just for you. Every single bite.
So good.
Expect nothing less at Taco John's.
As promised, a wet your tongue kind of break. So we are back. And yeah, Angel, just want to kick around with you, if there are any consequences, because watching the news reports, you've got, folks at the state level that are kind of bashing him. Obviously, the ones holding him accountable are saying what is obvious, which is there were some mistakes made here, there were some poor decisions made here. But then you have some other folks that are giving commentary he's a bad leader, and he's gonna some are calling for him to, I don't know, resign or whatever the case may be. I was like, that was a hard swing in the other direction in terms of what happened. I was like, wow. But, just kind of talk about what your thoughts, what your thoughts are as to where things might end up for him.
I think he has the platform to go after whatever he wants, really. The Cuomo name has been around for decades in New York. I'm from New York, Brooklyn, born and raised, and those are just one of those families that whatever opportunities that come up is really because it's already been established from their dad.
Right.
Family does a lot of charity work around the state and all of those things. So although what was done was quite egregious, I will not diminish what happened by any means, because you are affecting families and what the story is. At the same time, I don't think anything will tarnish his suit of armor. He has too many fans. I think New York will forget about it in no time, and if he decides to run for president, which is a rumor, anything's possible.
And after these last four, anything is possible.
We had all kinds of things happen in the last 4 years. It will not be a surprise to me. This wouldn't affect his career whatsoever.
Gotcha. He'll be fine. Yeah, for me personally, I figured this is a black eye. This is an unwanted black eye. Because I'll be honest with you, over the course of the year, seeing how, the reports were coming out, I was kind of rooting for him. I'm not gonna lie. Because I lived in Brooklyn, very familiar with the Cuomo name too. I was living up there when Daddy was, at the height of prominence. But seeing this, and I was just like, man, of all the states that have this problem, I was like, this wasn't needed right here. This wasn't something that needed to happen. But if nothing else, with any other political issue, any other medical issue, even with COVID-19, as we saw with the procedures, we're all coming away with a lesson here too. You know what I mean? Like, it's kind of like how people spill hot coffee and then all of a sudden you see the label on the cup, caution hot.
Exactly. Everything's been revealed.
Like, did we need this? Like, anytime you see something that's really obvious, you have to ask that question, like, okay, what happened to make this have to be obvious?
Right.
You know what I mean? But that's about the main silver lining out of this. You know what I mean? And as Angel always urges you guys, educate yourself, because
Google is free.
Google is free.
Government sites are free.
Absolutely.
Go from 9,000 something to 15,000 something.
That's a big jump.
But truth be told, I'm glad the two people, Mellissa DePosa and the other person, came forward, because a lot of times people get camped out into their political beliefs. Or I'm a Democrat, or I'm a liberal, or I'm a Republican, or I'm a non-party, I'm a Green Party, and they don't want to just tell the truth. And I have to give credit to the Trump administration for all the mistakes that they did make. This was a legitimate one. It wasn't a political act. It wasn't, politically motivated. There was actually something wrong. And back in late summer is when they're like, wait a minute, what's going on this state out of all the states? Mm-hmm. But nobody was listening until the numbers just really still didn't look right after Biden's in office. So, I mean, you can't cover up stuff but so long. And as far as Governor Cuomo goes, people remember names, and his name is so synonymous with New York. This really wouldn't hurt his career at all. I mean, he's got a book now, and he's got an Emmy, and he's got all these things that are so wonderful, which us regular folks don't get. Really, you have to have a name and money in New York to be in politics. So I just hope that people do their research for 2022 and not just go by a well-known name or how many zeros somebody has in their bank account. When you vote, make sure that person is speaking on your behalf in your community, like that they did the work. You know? That's the most important thing, because you will always get these strange folks, like the mayor down in Texas that told people they were lazy.
Oh, wow. I was...
What is that? And then he quits his job because you told the people, your constituents,
the ones that voted for
lazy
you,
for wanting help to not freeze to death. Texas already has 12 dead from carbon dioxide and not being able to stay warm.
Exactly.
I mean, he's sick of people asking for handouts. Excuse me, sir. Your job is paid by the taxes that those same people that asked for your help were being paid. But he stepped down, so at least he did something right in his short career.
That ain't it. In bad English, like you have to respond with the bad English, like that ain't it. Like that was the wrong response, sir.
Now that guy doesn't have a snowball's chance.
Literally. I see what you did there. Yeah, that was wow. That is what you call epic fail.
Ex-Mayor Boyd.
Gotta look for another job now.
Now that's a terrible person in office.
Which is why he's no longer in office.
Well, he quit. He had no choice. They were coming for him. Wait till it get warm, sir. Wait till it get warm.
Exactly.
Oh man, some people's homes, like, because I have a lot of family and friends in Texas, some people's homes are stuck at 60 degrees. That's the best they can do. And people are sleeping in their cars and dying from carbon monoxide
Monoxide.
poisoning.
Yeah.
So, yeah, that's terrible. They really were surprised by Mother Nature's little anger issues she's having across the country this year.
Yeah. Yeah.
Yeah,
This polar vortex is no joke.
that's all right. Sister state Florida sent out linemen, I think, as of yesterday. They were all trooped over to I-10 West for the
Yep.
rest. So it'll be all right. Our linemen are on the way.
Amen. All right, y'all. So on that note, we shall call it a show. As always, Angel, thank you so much for joining me. And guys, if you haven't yet, be sure to like, share, subscribe, follow, all of that, all of that. All of our socials are scrolling below on the screen at Florida National News, FNN News TV, FNN News Live. We've got all that stuff. You can find us on YouTube at Florida National News, on Instagram at Florida National News. We want to make sure that it was easy to find. And if you want some more Angel's knowledge, you can find her at A for Amazing on Instagram. So you can go ahead and follow her on Instagram there, tap into some more knowledge. And ladies and gentlemen, thank you as always for tuning in. We will be back next Wednesday. And before we end, you saw us running the ads during the show. If you are interested in advertising with us, just shoot us an email at ads@FloridaNationalNews.com. Or if you want to sponsor Let's Clarify, shoot us an email at ads@FloridaNationalNews.com. We'd love to hear from you. In the meantime, guys, continue to stay careful and stay safe. COVID-19 is still out here. We are not gone. We're not out of the woods yet. Yes, the vaccine is being distributed, but it's still out here. So continue to stay safe. Take care, guys. Thanks for tuning in.